Good morning. I'm Svetlana Lipanska. I get the distinct honor to be the Chief Executive Officer here at New York City Health and Hospitals, Coney Island. Thank you for joining us today. I would like to extend a warm welcome to our new Brooklyn Borough President, Antonio Reynoso. New York City Health and Hospitals President and Chief Executive Officer, Dr. Mitchell Katz. Coney Island Hospital staff. And here I will clap for you guys. Members of our Community Advisory Board. A Coney Island Hospital patient, Rebecca Ventura, who's joining us to speak today. Thank you. And our esteemed elected officials. I would like to thank Brooklyn Borough President Reynoso for his generous infusion of $18.5 million in capital funding for fiscal year 23. This money will help us complete a multi-year master plan for the future New York City Health and Hospitals, South Brooklyn Health, and its Ruth Bader Ginsburg Hospital. Provision of equitable and state-of-the-art women's healthcare services to the residents of South Brooklyn and neighboring communities is a cornerstone in the hospital's clinical strategy. It is our responsibility and every woman's right to have access to consistent, comprehensive, and excellent women's health services. It is inconceivable that Black women are 8 times more likely to die from complications during birth in New York City. I wholeheartedly support the Borough President's goal of addressing the maternal mortality disparity between women of color and their white counterparts, and making Brooklyn the safest borough in New York City to give birth. This important funding will go towards creating a contiguous, comprehensive women's health service on the 8th floor of our main and tower buildings. Services from outpatient care to labor and delivery to postpartum recovery will be brought together to ensure continuity and safety. Patient rooms and ancillary spaces will be upgraded to enhance total family care. Additionally, the neonatal intensive care unit and nursery will be redesigned to accommodate family needs to reflect the hospital's baby-friendly designation. This is a wonderful day in the history of this community hospital, where every day we strive to provide excellent healthcare for all. Once again, thank you for joining us on this momentous occasion. And now I turn the program over to our esteemed Brooklyn Borough President.
Good morning. How is everyone doing today? I'm so glad to be here. And for those that don't know, we are here in the center of the universe, that is Brooklyn, New York, in the southern portion of it, yes. In the southern portion of it, here in Coney Island, I'm very happy to be here amongst family and really presenting this funding to health and hospitals, as it is one of the most important things that we can possibly do in our time when it comes to dealing with inequities and disparities. This all started because 4 years ago, my wife was having a baby, or our baby, in Woodhull Hospital, where the experience was a second to none, an extraordinary experience alongside midwives in Woodhull Hospital. One of the midwives told me that if I knew that my wife had a 9.4 times higher likelihood to die during childbirth than her white counterpart. And I didn't know that information. I think it's common information that there's a disparity, but how drastic and how intense the disparity is something that is unfamiliar to many people, including myself as a council member back then. As a council member, I felt helpless, powerless. There was nothing I can do at that moment to make it so that my wife's experience would be safer, to make it so that her opportunities to not die were better. And after that time, I pledged and promised myself that I would be a foremost advocate for improving maternal health in this city. I also said that if I get an opportunity to be in a position of significant influence or power, I would do everything I could to make sure that we weren't dealing with this issue incrementally, but instead making it a significant change. Actually affecting change isn't giving $1 million at a time. Affecting change isn't allowing for one midwife every year, adding a midwife every year. It's about centering midwives and nurses in the birthing process and doulas in the birthing process, not making them second-tier role players in the birthing process. It's about educating doctors on historical health complications of Black women. It's about outfitting these spaces to be state-of-the-art, the envy of the world here in Brooklyn, New York. That's what it's about. It's all hands on deck if we want to deal with this issue that I think is, it is the greatest inequity that exists in our city. Nothing else is 9.4 times more likely for any person related to income inequality, educational attainment, nothing. 9.4 times. Black women dying during childbirth or in and around the childbirth, maternal mortality is the most significant inequity that exists. Now, the good thing here is that when the tide rises, all boats rise or something like that, it's gonna benefit everyone. No matter who comes to Coney Island, they're gonna benefit from the state-of-the-art birthing center. Now, I don't want luck to be the only way that we're safe here in this borough. I wanna make sure that we're actually providing resources and doing the best we can to make sure that women are safe. And that's why I'm here today. So I made a commitment when I ran for office that I was going to commit all of my money to maternal health my first year in office. And that's exactly what we did today. We dedicated 45 of my capital dollars, $45 million to the 3 public hospitals in Brooklyn, in Woodhull, Kings County, and Coney Island for state-of-the-art maternal health. It's important, one, as elected officials, that you keep your promises, but it's also important, again, that we shatter the notion that incremental change is the way that we're gonna make progress. It is not. I don't want it to be 9.4 this year, 9.2 next year, 9.1 the year after that, and then 9 before my first term is up. I'm going to make Brooklyn the safest place in New York City for all women to have babies. But if I get the opportunity to be here for 8, I will make Brooklyn the safest place for all women to have babies in this country. And that is the goal that we're trying to set here in Brooklyn, and Brooklyn should always be the model for those types of goals. I also want to acknowledge that we also started a maternal health task force that is headed by a midwife and a health and hospitals employee. We're starting this task force because, again, this is just where we're starting. We need to talk about everything else we need to do. We need to reach women in daycare centers. We need to reach women before they're even of birthing age. We're talking to partnerships throughout this city on being able to reach young women and teach them about what they can do to ensure that they're in a better position or condition to have babies. And that's the type of work we're gonna start with this maternal health task force, because I'm giving this funding in the capital side, but we're also dedicating expense funding on education and information in areas like Coney Island to make sure that all women are safe. Now in Spanish, very quickly. Durante mi campaña prometí dar todo mi financiamiento de capital de 2023 para ayudar a cerrar las disparidades en la tasa de mortalidad materna. Puedo decir con confianza que estoy cumpliendo en esa promesa, anunciar que el total de los 45 millones de financiamiento de capital para el 2023 se dividirían entre los 3 hospitales públicos en Brooklyn. 18.5 millones de estos 45 millones irá al hospital de Coney Island a expandir los servicios integrados de salud de mujer. Mi objetivo es lograr el mayor impacto posible en torno de la mortalidad y morbilidad materna. Y este es solo el primer paso. So, now, what we're going to do, because last time we did this in Woodhull, some of the elected officials had to go, and we want to acknowledge the work that they're doing. And I want to, this is also a call to action on the elected officials, is continue to support this hospital, continue to support maternal health and the work that we're gonna do. And I wanna thank them all for being here, and I wanna give them an opportunity to be in front of the check because they are my partners, and they are the ones on the ground that are telling me what's happening and how I need to be helpful, so I wanna make sure that they're a part of it. But I'm also want to make sure that we don't lose anyone from our panel as well. So the next step is I get to give out these cool checks. This is it. And I'm giving this to Health and Hospitals and Coney Island. Let's stand up here, up front. And I told this to Cass before, and I heard he still try to put it through an ATM. It will not fit in the ATM. Come on, is this, can we stand up front there? Wherever you. And now I want to just call up a couple of our champions and the people that have been supporting me throughout this entire process to ensure that it comes to fruition. And I want to start off with a person who I think is arguably the greatest leader we've had over the last decade when it comes to the work we're doing with Health and Hospitals. As a council member, I was a member of the Health and Hospitals Committee, and Dr. Katz was introduced to me then. And when I first met Dr. Katz, I was concerned because the history of the head of Health and Hospitals is people that advocate for attrition, that advocate for austerity, right? To get rid of people because we need to save money. The first thing that came out of his mouth is the way we're gonna get out of this hole is by spending more, bringing more services to our hospitals, bringing more services so that more people come in. And imagine if he didn't do that, because maybe 2 years after that conversation, COVID hits. And imagine what the hospitals would be, the people we would have lost, if a leader would have come in and said, we need to cut, not expand. And it's because of that that I'm so grateful that I'm able to do this work for the hospitals today alongside my partner, Dr. Katz.
Thank you. Good morning, everybody. We're so lucky to have a borough president who really cares about health and who in particular really cares about women's health, and I know he's going to be there for the full 8 years. And again, always remember what happens to previous Brooklyn borough presidents, right? It's a nice path. It's working well. The Coney Island Hospital is my community hospital, the community hospital my family used when I was growing up. You could walk to where I went to school, PS 206 to PS 254 from here. This is my community. This is where my siblings went for healthcare. I went, my parents went, and so I'm incredibly moved by the amazing care that's provided here at Coney Island Hospital. And thank you. The borough president referred to, how important the public sector is, and I think people don't get it. There is this, misbelief that people who work in government, well, they're not going to do a good job, and we showed them through COVID, right? Everybody learned that if you wanted good care, right, you went to one of our public hospitals. If you needed a test and you needed the result right away, you went to one of our public hospitals. If you needed an immunization, you went to one of our hospitals, right? Our hospitals vaccinated a much higher proportion of people of color than any of the private hospital sectors, because this is our mission, taking care of immigrants, taking care of low-income people, and providing the highest level of care. And I know Coney Island did that throughout the worst parts of COVID. So thinking just about this gift, I want to close by raising a sort of theoretical argument that the borough president is fulfilling. And the theory is called collective action. And it says that one of the reasons we fail to solve modern problems is because we never put all our chips to solve that one problem. We sort of dole it out. And there are any number of good causes, right? There are lots of things that we all believe in, lots of great things in the health sector, In the non-health sector, different populations. But the theory of collective action is that if you want to make a difference on a problem like maternal morbidity and mortality, you got to put all your chips in. And you got to say, this is the problem that I am going to solve. And he's done that. He put all his chips in. No one has ever done that before. Everybody else in his position has said, here's a good cause, I'm going to give a little of my discretionary money to. Here's another good cause, I'm going to, and all of this is good, and I don't mean to put that down, but that's not how change happens. Change happens all in. And I love that the delegation is here, and the chair of the hospital committee, who has been she's been an amazing advocate, Council Member Narcisse, for public hospitals, and has made clear that she believes in public hospitals, that she knows that we do great work and that she has our back. And so I feel that collective spirit is with us. So thank you all.
Now I want to call up the leadership of Coney Island Hospital, and we're going to call up the Chief Medical Officer, Dr. Terrence Brady.
Good morning, Borough President Reynoso, Dr. Katz, distinguished guests, and colleagues. I'm Dr. Terrence Brady, the Chief Medical Officer at New York Health Hospitals, Coney Island. On behalf of the physicians, midwives, and our wonderful nurses under the leadership of our Chief Nursing Officer, Dr. Manjinder Kaur, I would personally like to thank Borough President Reynoso for his substantial gift to Coney Island Hospital. These funds will assist us in providing patient-centered and comprehensive women's health care services to our patients and the residents of the South Brooklyn community and our surrounding communities. At Coney Island Hospital, we ensure that compassionate quality care doesn't begin or end with delivery. Rather, it is provided from prenatal care to labor and delivery and after childbirth. We are committed to addressing the racial disparities of maternal mortality and look forward to continuing our partnership with Borough President Reynoso. Thank you for joining us today, and I now turn the program over to Daniel Lasser, our Chief of Perinatology.
Good morning, everyone, especially to Borough President Reynoso, to Dr. Katz, and all our distinguished guests. I am Dr. Daniel Lasser. I'm the Director of Perinatology, that's high-risk obstetrics, and Director of OBGYN ultrasound here at New York City Health and Hospitals, Coney Island. On behalf of the entire OBGYN department, I'd like to express my sincere gratitude to Borough President Reynoso for his extraordinary commitment to improving women's health care in South Brooklyn. And we echo his passion enthusiastically. His support will enable us to make a positive impact in the lives of patients we serve, to give every mother, every baby, and every woman a sense of belonging and hope for a brighter future. I can't overstate the seriousness of our commitment to doing right by women of color and ensuring that they receive the high quality of care that they deserve. Again, thank you, Borough President Reynoso. We look forward to partnering with you to make Brooklyn the safest borough to give birth.
Now we are going to call up a patient, somebody that's actually using the services here in Coney Island. To say a few words, we want to call up Rebecca Ventura. Rebecca?
¿Estás bien? Okay. Dale. Buenos días, presidente del Condado de Brooklyn, Antonio Reynoso. Buenos días a todos los presentes. Mi nombre es Rebeca Ventura. Vivo en la comunidad del sur de Brooklyn. Soy paciente del Hospital Coney Island por los últimos 11 años. Precisamente tengo 9 meses de embarazo. Estoy a punto de dar a luz. Estoy muy feliz que el presidente del Borough de Brooklyn haya hecho esta donación de $18.5 millones al Hospital Coney Island. Este dinero es donado para mejorar el servicio de maternidad. Les recomiendo a todas las madres, a todas las mujeres que vengan al Hospital Coney Island. Es un muy buen hospital. Tuve a mi hija hace 10 años, está aquí presente. Los doctores son fantásticos, las enfermeras, todos muy buenas personas. Le agradezco al presidente por su donativo. Gracias.
Parece conmigo, parece conmigo. For those of you who don't speak Spanish, I'm going to translate for her. She stated, good morning, my name is Rebecca Redentura. I live in the community of South Brooklyn. I am currently a patient of Coney Island Hospital for the last 11 years. Presently, I am 9 months pregnant. I am waiting to give birth any day. I am very happy that the Borough President Reynoso has donated the $18.5 million to Coney Island Hospital. We appreciate you. Thank you, because Coney Island Hospital is an amazing hospital. I had my daughter here 10 years ago who is present with us today, and the doctors are amazing. Thank you very much. Gracias. Thank you, sir.
Okay. And I just want to acknowledge that we were joined before they had to leave by Councilmember Vernikov and Councilmember Kagan. I wanted to thank them for being here. And now we've already talked a bit about her. This is, I call her my sister from the other side of the island of Hispaniola, and the Health and Hospitals Chair, and has been my partner in crime in this work. I want to call up Councilmember Mercedes Narcís.
Good morning, everyone. My name is Mercedes Narcís, and I represent the 46th district, which is southeast of Brooklyn, this is from Canarsie to all the way to Ships Head Bay. But unfortunately, I don't have any hospital or any healthcare center in my community. So therefore, my constituents rely on Kings County, Coney Island for public health, public hospital. We have Brookdale not too far as well, so I cannot forget Brookdale. I want to go back home. It seems like this place is my home because yesterday I was here. As a chair of hospitals, my whole idea of health and being a registered nurse for over 3 decades is to address the inequities in the healthcare system. We saw what happened with COVID. During the height of the pandemic, we lost so many lives because of access to quality healthcare and preventive care. So it's always my pleasure. And being a worker too, I was a registered nurse in Elmhurst Hospital, which is public hospital as well. So I understand the inequities and we need to address it. And for me, most importantly, I will go down to my word, which is competitive. So my brother from the other side of the island, thank you for being so aggressive to address the inequities in maternal health. To give $18 million of your money to address that. So not only the talk, not only the work, you actually do more than that. I would say you put your heart and soul to address it. So thank you. As a nurse, I'm looking forward to see where we have our public hospital very competitive in every aspect, in the delivery of the care, in holding and not only recruit, we have to retain our staff. And how the best way to do that is the way that Coney Island is doing it. Thank you. Yesterday when I was here, I was very impressed, by the way. As a nurse for 3 decades, seeing how you Actually, guys, the whole team, thank you. The administration, thank you for doing what you're doing, recognizing the hard work of the nurses, the doctors, the PA, everyone, and trying to grow the staff that you have. We know that we cannot only recruit, we have to retain now. It is very hard, but you are doing it. So thank you. So I'm looking further to see the vision and the caring in our public health system, to make sure that it is not based on socioeconomic, color, race, or gender, but it's about the New York City. If we are example, we have to stand by being the real example on every aspect. So thank you, my brother, from another side of the island. I love you. Let's do the best we can for our public health. Thank you.
Thank you, Councilmember Narcisse. And now, at the state level, a lot of work needs to be done as well to help us get to where we need to get to. And just this year, a law or an executive order, I believe it was an executive order by the Governor Hochul, in which now women that are going through postpartum depression can get services if they're on Medicaid for 1 year. Before then, it was only 3 months. And if you know anything about healthcare, that one, the healthcare should be provided so long as the service is needed. There shouldn't be a timeline as to when you can get these services. So even a year is not enough for me. It should be as long as you need it, you get it. But going from 3 months to a year is really going to save lives. It's part of the work that we need to do as members of government to continue to save women's lives. And the deaths that happen after the baby is born is also a part of the work that we're doing. So I want to thank the state for that type of effort and the work that has been going on there. And one of the leaders and champions of that work in healthcare is Assemblymember Matilde Francis. So please, Assemblymember Francis, come up.
Good morning, everyone. Let me put my glasses on so I can see. It feels really, really great to be back in this room. This room is so sentimental to me because I am a longtime Coney Island resident who came here for many years to attend the CB13 meetings. Anybody else? Okay. And I was actually a CAB member, a community advisory board member for this hospital for many years. So it's good to be back here. I have so many things I could say about our new borough president. He is a breath of fresh air. How about a round of applause for having someone just a really kind-hearted, gentle soul, but a visionary as well. And it means so much to me. It means so much to me to see you here today. It means so much to the people of Coney Island. When you present this check today, you're not just presenting it to the hospital, this building, you're not just presenting it to the administrators and the executives. This check is for the people of this community. And I can stand here all day and tell you what this community means to us who are from this neighborhood, as Dr. Katz said before. We have so many memories of coming here from our childhood, our family members. This hospital is for everyone, regardless of how much money is in your pocket, regardless of what language you speak. Whether you just got to the United States, you can walk right in and this hospital will take care of you. I've seen it with my own eyes. And who knew that one day I would grow up to become the assemblywoman for this area and representing this hospital. Look, I want to say a few words when we talk about racial disparities. Racial disparities are not new. Racial disparities are all around us. We have racial disparities in homeownership. We have racial disparities in educational attainment, as you spoke about earlier. Racial disparities with so many things going on in our society. But I agree with the borough president that when it comes to maternal health, when it comes to maternal health care, we are talking about life or death. That's what we're talking about. And so this check will save lives. This investment that you're making today will actually help us save lives. And I can't think of anything else to make us more appreciative of what you're doing. I'm just thinking of all of the families who really need these services, who really need care. I think about all the stories that we've heard over the years of Black women losing their lives during childbirth. That should be a thing of the past. I pray that in the near future, we never hear of such stories again, and thank you for caring about this issue.
Thank you, Assemblymember. I want to leave by just saying thank you to all the staff of the hospital. This is not easy work. I know that it's a government institution, it's health and hospitals. We try to put it together a lot of times with duct tape and gum, but you are what makes it work. If the service is satisfactory, it really means something to the community, because there are folks that don't get acknowledged and are often overlooked by the general public. They can't go to a private hospital, but they know if they come to Coney Island that they can expect the same type of care and service because you're here, because of the work that you're doing. So I just really want to thank you all for the work that you're doing, because this is also a day for you. So thank you so much to the staff. So that's the end of the program. I just want to say thank you again to everyone, the administrators as well. And don't forget to spread love. It's the Brooklyn way. Thank you so much.